Picture this. You're a nurse setting up a gravity IV infusion, and your patient needs fluid stat. How do you ensure the IV flows correctly? Let's dive into a high-yield NCLEX case study to sharpen your clinical reasoning. Today, we're tackling gravity IV infusion, a skill you might see in NCLEX or in settings without infusion pumps. Let's use the ADPI framework to break it down. Assessment. Start by checking the IV bag height. It must be at least 18 inches above the infusion site to create enough pressure for gravity to work. Assess the tubing for kinks, the IV site for patency, and the patient's position, as bending an arm can slow the flow. Diagnosis. Identify barriers to proper flow. Is the bag too low? Is there an occlusion? Low bag height or tubing issues can stop the fluid from reaching the patient effectively. Planning. Plan to hang the IV bag at least 18 inches above the site. Here's a novel term. Hydrostatic pressure, the force created by the height of the fluid column that drives flow in gravity infusions. You'll also calculate the drop rate using the roller clamp to deliver the prescribed volume. Implementation. Adjust the roller clamp to control the flow rate. Ensure the bag is elevated properly, 18 inches or more, and clear any occlusions. Teach the patient to avoid bending the arm with the IV to prevent flow interruptions. Evaluation. Monitor the infusion rate to confirm it matches the prescribed volume. Check the IV site for signs of infiltration or discomfort, and ensure the bag doesn't run dry. Recalculate the drop rate if needed to maintain accuracy. This brings us to our NCLEX style question. Which must a nurse consider when using gravity to deliver IV fluids? A. Elevate the solution at least 18 inches above the infusion site. B. The lower the level of the solution, the faster the fluid is administered. C. The nurse should use a pressure infusion sleeve to slow down the rate. D. The rate of flow is mostly affected by the osmolarity of the fluid. Correct answer. A. Elevate the solution at least 18 inches above the infusion site. Rationale. Gravity infusion relies on hydrostatic pressure, which depends on the bag's height. At least 18 inches above the site ensures enough pressure for fluid flow. Option B is incorrect. Lower bags slow the flow. Option C is wrong. Pressure sleeves speed up, not slow, the rate. Option D is false. Osmolarity doesn't affect gravity flow. Clinical application. In practice, always check bag height and tubing to avoid under or over infusion. Nursing tip. Practice calculating drop rates for gravity infusions. It's a common NCLEX skill. Future nurses, love these NCLEX tips? Subscribe, hit the bell for daily drops, like, and share with your study group.